From the Alvin and Rosalie Sarachek studio, PBS Kansas presents Kansas Week.
It's a growing problem, ruining and even ending lives across the state at ever-increasing rates. It's changed how police do their jobs, left taxpayers paying a hefty bill, and costing business owners millions. We're talking about the mental health of our state tonight on Kansas Week. Welcome to a special edition of Kansas Week on the state of mental health in Kansas. I'm your host, Pilar Pedraza. From crime to homelessness, the fentanyl epidemic to increasing suicide rates, so many of the problems we've discussed on this show have one root: poor mental health care. An annual study puts Kansas dead last for the care it provides. The annual State of Mental Health in America survey ranked Kansas the worst state in the country for mental health care for a second year in a row. Though since this year's study covers 2020, the beginning of the pandemic, authors say this year's report can't truly be compared to previous years. Study authors say the indicators that had the biggest effect on Kansas' poor ranking were youth with substance use disorders in the past year, more than 9%, adults with any mental illness, more than 1 in 4, and adults with serious thoughts of suicide, almost 6.5% of Kansans. Kansas also ranked low on access measures, particularly for youth with depressive disorder getting consistent treatment. Kansas ranked lowest in the nation here, with only 6.5% receiving needed care, as opposed to the national average of 28%. Mental health care providers generally point to Kansas' large swaths of rural communities and difficulty attracting behavioral health professionals and difficulty attracting behavioral health providers to explain the low rankings. But not everyone agrees. And here to dive into this report with me today and many other issues related to the state of mental health in Kansas, we have Robin Chadwick from Ascension Via Christi, James Hook with the National Alliance on Mental Illness, Wichita chapter, and Eric Litweiler from the Mental Health Association of South Central Kansas. Welcome to all of you. And as we start on this, Eric, you were quoted in one of the articles that I saw about this study, talking about the causes of why Kansas is doing so poorly. And you said, you know what, we're doing so badly, those causes aren't really worth their weight in paper anymore.
Yeah, it's difficult to pin down one specific cause necessarily. What really struck me when I first saw our ranking 51 out of 51 was that so many times people in past years have kind of justified or rationalized, oh, well, Kansas is only 47 or 48, so somebody's worse, and this is probably why we're bad, but other states are worse, and that explains it. And I hear reasons like, well, we're such a rural state, or, oh, there's such a divide between the urban and the rural spaces, or, oh, it's a function of, per capita spending on healthcare by the state, or something like that. When you're dead last, regardless of what they try to use to rationalize the issue, there's always 6, 8, 10, 12 states that are worse than you in any one of those measures, and yet on the survey, they're doing better than you. So all those excuses go out the window, and you're left kind of sitting there twiddling your thumbs trying to figure out what are we worst at that indicates why we're 51 on this report. And I remember getting the report the first time and looking at it and started just Googling statistics about things that I thought might explain it, and no one thing that I could find really did it. At MHA, we talk so much about access. And people think about access to mental health care, and they either think about geography or they think about the lack of clinicians. But my thing is, I can live right next door to a therapy center, but if I'm a 25-year-old Asian female and I walk in and every therapist I see is a 60-year-old white male, they can't understand my experiences, they can't understand my background, they don't understand my upbringing. I can live right next door, but that's still an issue of access. It's culturally competent care. They might not even speak my language for that matter. So it's still an issue of access, and I really contend that that's a huge part of that ranking for Kansas.
What about you? What are you saying, Robin?
I think that's a great point, that access includes not only the availability, but do the providers look like me, sound like me, have experiences similar to mine? That's a big piece. I also think that provider access is a piece. When you think, and I work a lot with psychiatrists, In Wichita, we have a handful of adolescent and child psychiatrists. A city our size should have over 30. You think about rural Kansas, access to a psychiatrist west of Wichita is pretty sketchy. I mean, Hutchinson, yes, but then beyond Hutchinson, there is really no access. Telehealth over the last 3 years, the availability of telepsychiatry has improved some, but that still is not a great solution. One of the things I'm really excited about is KU School of Medicine is starting a child and adolescent psychiatry fellowship in the coming year, and that will produce a couple of child and adolescent trained psychiatrists each year. So we may begin to see some improvement in access for kids, because we've really got to get to our kids.
Yeah, telehealth is one of those things. I mean, it's not ideal, like you say, but it's better than nothing. I will tell you that when we were sent home for the pandemic in early 2020, by the end of the year, we were serving people in 39 Kansas counties and 7 surrounding states. There are other Mental Health America offices much closer, especially when you talk about other states, but we were the ones that had telehealth up and running. And so people from Nebraska and Arkansas and Oklahoma were calling us because we were up and running with that, and while not ideal, it was at least an option. So that's huge. And yeah, I mean, pediatric psychiatry, I know people who are using telehealth, pediatric psychologists from Hawaii, because it's the best they can do. We're in the middle of the state, we're calling guys in Hawaii to talk our kids through the mental health crisis there. There's no excuse for that.
Right.
Yeah.
What are you saying, James?
A lot of this comes back, nothing is new, nothing's a surprise. I mean, this started back in the 90s when we switched concepts from state hospitals to community centers to keep individuals in the community, to keep from having to hospitalize them. We had great concepts, great ideas. The problem is nobody funded anything. So we can have the best ideas in the world, in the country, but if you don't have the funding there to have the resources available, the therapist, the facility, the training, that's a huge one for not just the therapists, the social workers, law enforcement, the community in general. If the funding's not there, then the resources falter. If the resources aren't there, then the whole thing just falls apart. And fast forward 30, 40 years, we see the outcome of that where we're at now.
If you go back 20 or 30 years in Wichita, there were over 600 inpatient behavioral health beds. We had charter, we had CPC Great Plains, HCA had beds. You look now in 2023, there are 101 beds at St. Joseph, and there are beds for kids at KVC, and that's it.
Yeah.
So we have lost 500 plus inpatient beds, so access for inpatient care is grossly underserved.
About a year and a half ago, you told city and county leaders, Robin, we are in crisis mode. And a few minutes before we started recording, you said it's even worse now.
It is. When you think about access to inpatient care, if you're an adult in Kansas, Ascension Via Christi St. Joseph really is it. You've got to go to the eastern half of the state to be able to access inpatient care. About 3 years back, we looked at the number of Kansas counties that we serve at Ascension Via Christi St. Joe, and it was 58. Post-pandemic, 70. Last year we admitted patients from 70 different Kansas counties into one facility.
Wow.
And I'm hearing rumors that whatever the demand was this year, it was 13,000 and maybe 1,500 people served just in Sedgwick County. That number is expected next year to increase by, the number I've heard was 65%. That is scary.
Mm-hmm. Yeah. Very much so. And a couple of years ago, we started seeing some changes at various different levels, from city and county to the state, some already in use at this point. And we're taking a look at where they're going next. Kansas News Service's Celia Yopis-Jepson reports Sedgwick County has already taken several steps to make mental health services more accessible for inmates in the county jail. March 2022, the Sedgwick County Commission joined a national effort, the Stepping Up Initiative, to reduce the number of people with mental illness in jail. Sheriff Jeff Easter has estimated about 1/3 of people in the approximately 1,500-person jail have a mental illness. Since then, the county jail has put a number of steps in motion, like no longer charging people in jail a $5 copay for mental health medication and screening every person who enters the facility for mental illnesses. In 2019, the city of Wichita teamed up with Sedgwick County to form ICT-1, a program aimed at changing how first responders handle mental crises as a health problem, not a crime. ICT-1 teams up a qualified mental health professional, a law enforcement officer, and a paramedic. They respond to 911 calls for patients who are experiencing suicidality, substance use issues, psychosis, delusions, and other mental health problems. What began as a 90-day pilot has since expanded as the program has proved its ability to help. One of the biggest complaints from first responders and healthcare providers across the state is the lack of beds in mental health facilities for those who need treatment. Just this week, the state approved $25 million for South Central Kansas Psychiatric Hospital. Sedgwick County plans to use the money to create a new 50-bed mental health hospital owned and operated by the state. Currently, the only state psychiatric hospitals are in Larned and Osawatomie. The facility will be developed with room for expansion. In announcing the Strengthening People and Revitalizing Kansas, or SPARK grant, Governor Laura Kelly said, "My administration continues to be laser focused on increasing access to mental health resources and care, which is fundamental to safe and healthy communities." The same day that Kansas Business Journal reports, KVC plans to build a 72,700 square foot facility in Olathe. That's to open in late 2024, with help from a state of Kansas grant. The new hospital will have 72 inpatient beds, with 48 of those for children. A lot of changes, some already in place, some still coming. How much of a difference have these changes made? James, I know you have a lot of frontline experience there.
Yeah, the changes that we see, they're great. They're needed, and they've been needed for a long time. The problem is the sheer intensity, the volume of what we're seeing. 40 more beds for juveniles is great, except we have way more than that need those beds. So those beds that aren't even there are already spoken for. So it's a step in the right direction, but it's still not enough. And we still need more. We still need a lot of resources, a lot of changes made. It's just a slow process, I think, in the evolution of our mental health.
What sort of changes do you think we still need, Robin?
Workforce is huge. I'm excited about the coming state hospital because that will increase access for persons who are court committed into care. But I am very worried about how we will staff that. So we'll need more psychiatrists, we'll need more nurses, and every hospital in town already struggles to hire enough nurses to keep our beds open. And we need social workers, and I'm sure Eric's organization uses social workers just like we do at Ascension Via Christi. And it's a challenge to hire enough social workers who have the experience and the knowledge to work in behavioral health.
Yeah, pre-pandemic, we're already the largest nonprofit housing provider in the state for people living with mental illness. And pre-pandemic, we identified our housing division as the area we want to grow in the next 3 to 5 years, because no one saw COVID coming at that time. But I was kind of turned loose to seek out opportunities to grow the housing division, because there have been wait lists since I've been there, and I'm sure long before. So I start talking to partner organizations in town who came up with some really creative ideas of here's a facility we could buy and turn this into a thing for you, or we could do this, or we could do that. I must have looked at a half a dozen real estate deals that partners brought to me, and some of them were great, but I had to keep telling them, I love this, thank you, this would be phenomenal, but we can't staff it. There was one guy I must have told him a half a dozen times as I'm reviewing, this is great, we would love to do it, but I can't staff it. He just couldn't hear it. He was so dead set on helping us out, he couldn't hear me telling him that. We'd love to increase the housing, we'd love to increase the outpatient care, but we can't staff it. There's no pipeline. Right now, best case scenario, organizations are moving clinicians from point A to point B. You raise the salaries over here, they're all going to go over here. If I can raise salaries tomorrow, they're going to come back or they're going to go to somewhere else. We're moving them around, but we're not increasing capacity across the state. We're moving them from one organization to another, to another, to another. And so you're right, I think the new school coming in, there's some clinicians, we're working with legislative liaisons through the Chamber of Commerce, through Intrust Bank. We're trying to address legislative bottlenecks that are creating these issues. But yeah, you're absolutely right. Workforce is probably the single biggest concern right now.
I agree. So, I mean, you look at not just therapists, mental health, law enforcement is the same way.
Yeah.
You know, your frontline responders are all down in numbers. Even within NAMI Wichita, we see just the number of people wanting to utilize our services come through is increasing, but you know, the number of volunteers that we have available to us to go get trained, to put on some of the different classes that NAMI Wichita offers, you know, we struggle in that department to get those people in and retain them, get the training done and provide those.
Of course, this all costs money, but advocates say it's more expensive to do nothing. A KMUW report shows that the 195,000 some Wichitans employed in the city combined cost their employers nearly $1.4 billion in lost productivity a year due to untreated mental illness. And mental health issues are behind up to 40% of all job turnover in the city, adding to the costs of recruiting and training replacements. A Health Forward Foundation study shows the greater Kansas City area pays a $624 million price for untreated mental illness, where about 1 in every 10 adults has a serious mental health problem. About 40% of cases currently untreated. Meanwhile, the Leonard Schaefer Center for Health Policy and Economics estimates the overall annual cost of incarcerating people with serious mental illness in state prisons in Kansas exceeds $110 million. And that's just the start of the numbers. Eric, that $1.4 billion for the city of Wichita, that's your figure. How did you reach it?
So the really easy answer is it's basically the size of the workforce times $7,000, which is the estimated cost of one employee who works in the Wichita area. Where that $7,000 comes from is really the question, and that comes from a variety of places. It's a combination of things like turnover costs. Any HR officer or director in the city can tell you what it costs when one person leaves, whether they're fired, whether they quit, but there's costs in recruiting and training and all those sorts of things. So that's part of it. Part of it certainly is the utilization of insurance benefits. People who are coming to work every day with mental health issues are significantly higher utilizers of things like health insurance, vision, dental, all kinds of benefits. One of the big ones is something like absenteeism. There's an estimate that something like 200 million days per year are lost due to mental illness, and these are people not coming into work. Forbes placed a figure on that of about $45 billion a year in the United States, and that figure was just depression. That's not anxiety, that's not substance, that's just depression. $45 billion absenteeism. And then on top of that, you have the concept of presenteeism. Presenteeism is where we do come into work, but we're sitting there looking at a computer screen and all we can think about is, I'm shipping my only child off to college, or my mom's on a ventilator, or my wife asked for a divorce. So I'm sitting there staring at a screen, and so it looks like I'm working. And so because it looks that way, I can sit in that situation for days, for weeks, for months on end with nobody asking the question. The Harvard Business Review actually estimated that the cost of presenteeism is about 10 times the cost of absenteeism. But again, because you can languish in that situation for a long period of time. So that 7,000 is comprised of all those costs and many more direct and indirect, but those are probably the biggies.
Other costs that I haven't mentioned?
That's just the workforce cost.
Yes.
That doesn't even account for the individuals that have the severe mental illness that are not in the workforce, the ones that are on state or government assistance that come through Medicare, Medicaid, are on or off their medication, the cost to the public, the ones wandering the streets, the homeless with substance abuse, mental health, the crimes, the damage that's caused that you see all throughout the city, the hospitalizations, the ones that don't have any kind of insurance, whether that's state assistance or not, that, somebody's footing the bill and covering that cost. And so that all goes into it on top of just the cost to the workplace.
That's a really good point. It's the entire social safety net, because while they're higher utilizers of insurance benefits at work, they're also high utilizers of emergency rooms, prisons, law enforcement, firefighter, and that's why the housing first model is so important. At least if we can get people into safe and stable housing, we cut down a lot of those social safety net costs.
Yeah.
What about you with Ascension?
Each year, just within behavioral health, we provide nearly $20 million a year in uncompensated care. So that's a lot of care that we're providing that there is no compensation for.
Well, that's not the only issue, though. We also have one place where we're spending increasing amounts of money, and that's reacting to the results of untreated mental health issues and the growing epidemic of drug overdoses and addictions, especially the deadly drug of fentanyl. The Kaiser Family Foundation reports the pandemic coincided with an increase in substance use and increased death rates due to substances. In 2021, the drug overdose rate in Kansas was almost 2.5 times what we saw a decade earlier, with opioid overdoses being the primary driver. Meanwhile, Kansas's age-adjusted suicide rate was higher than the national level in 2021. All of this at a time when a new national study from Myriad Genetics found while nearly all Americans agree substance and behavioral addictions often mask underlying mental health issues, more than 3 in 4 have used one or more addictive behaviors to cope with life in the last year. And that's kind of one of the issues is so many of us have dealt with issues over the last few years, especially since the pandemic, maybe not aware that what we're dealing with is a mental health issue. And just awareness, so vitally important, Robin.
Excuse me. It is so important because you can be sitting next to someone and not be aware that they have issues or need help.
Yeah. And I know MHA also deals with that a lot.
Yeah, absolutely. You mentioned earlier the statistic about 40% of people actually seek and receive the treatment they need. When we're talking about substance use disorders, that 40% seeking help drops to 10%. So 90% of people with a diagnosable substance use disorder are not seeking and receiving the care they need. And back to your point, the costs of that are astronomical, both for the community and for the workplace. We saw so much of that during COVID. People were using what I'm euphemistically referring to as coping skills to try to cope with the increased stress. And so many of us think about things like drugs or alcohol, but it's behaviors. It was gambling, it was food, it was online shopping. The human body can figure out so many ways of getting addicted to so many things. And under normal circumstances, when you do that, it's not ideal, but okay. But if you're feeling 3 times the stress and people think the answer is 3 times the coping mechanism, you really quickly cross the line from an unhealthy behavior to a full-blown substance use disorder, and that's really concerning.
And James, you were talking about the impact the pandemic had on all of this.
Yeah, we look at terms of stigma, creating awareness for mental health and the mental health concerns that we have. Someone has high blood pressure, heart problems, that's commonplace. We talk about that all the time. You talk about depression, bipolar, mental health. No one wants to be that person that's seen as in the corner, talking to themselves, schizophrenia, some of the more severe ones that we see, that makes people uncomfortable. So we tend to kind of push that aside. With 2020 and the pandemic, it kind of increased that awareness to the stigma about what mental health actually is. It's not always the severe and persistent that you think about with schizophrenia and some of the more severe psychosis. It's that simple depression. I'm sad, I haven't been outside, I haven't seen my family, my friends. So it brought a lot more awareness to mental health in the public than probably we've seen in many, many years, which has been good for the topic.
Yeah. And awareness, Robin, really kind of the first step, an ounce of prevention worth a pound of cure.
I think you're exactly right. The pandemic has really brought to light that it's becoming much more okay to talk about it, because through the pandemic it made it okay to say, man, I am so isolated. I feel so disconnected from my family, from my friends. And so it has opened up the door a little bit to be able to talk about it. We have one of the groups within our inpatient behavioral health they love to order jackets, and the current theme is End the Stigma.
Yeah.
And that is really our team's mission right now, is to go out into the public and into our community to help end the stigma.
And in fact, Ascension Via Christi involved with a project called Cause for Hope, which I also was involved in, trying to do exactly that to a certain extent, trying to just get people talking about it.
Right. If we could just begin to talk about it. James mentioned severe and persistent mental illness. Having conversations with your friends and family is not going to help when you have a persistent, severe mental illness. But when you're dealing with depression, anxiety, having those personal connections and being able to reach out to someone, it does help and it makes a difference.
Yeah, down in Wichita, we see that a lot. So we offer support groups that are free for family and individuals living with mental health concerns. So they come, they have that immediate connection. They're able to talk, to say, that's not just me. You're experiencing that too. You know, this is what I feel like. If you feel kind of the same way and you get that connection, it's just nice to talk and realize it's not just you. You're not on an island. You're not the only one. As well as, you know, being able to go out in the public. And NAMI Wichita has different classes and presentations that are able to let people know that, hey, this is what that is. This is why it happens. This is why we talk about it. So it puts the word out there. It helps create that awareness and help reduce that stigma.
Now, I know social media gets a bad rap for the role that it oftentimes plays in mental health issues, but to a certain extent, perhaps all of us on social media during the pandemic may be part of why we all realized, oh, we're all dealing with this.
I think that could be true. You know, when especially high-profile names are willing to talk openly and honestly about it, that's when you see the general public talking more about it. And then there's a part of me that doesn't really like that, because we shouldn't have to wait for someone famous to acknowledge anxiety or depression for us to talk about it. But if that's what it takes to open up the conversation, then so be it. We'll take that. Social media has made it that much easier for people to be open and transparent. I've always said, you know, if we're having a conversation and I'm not talking about my mental health, then you think you're alone. If you're not talking about yours, I think I'm alone. And you multiply that times 640,000 people in the Wichita metro area, we all think we're alone.
Yep, and we're going to have to leave it there. Thank you all so much. And thank you. I hope maybe this has opened your eyes to some of the things out there that would help with mental health. We'd love to continue it online. Just look for Pilar Pedraza TV or PBS Kansas on Facebook, Twitter, or Instagram. If you feel like you're facing a mental health crisis or are contemplating suicide, we encourage you to call the new Lifeline 988 and speak with someone today. Stay safe and have a great week.